The Secretary General of the Gulf Cooperation Council, Dr. Abdulatif Al-Zayani, said that the Houthi group continues to obstruct efforts to return to the political track to reach a political solution based on the three references, and continued military escalation through the bombing of populated cities and the threat of navigation in the Red Sea, and continued firing of ballistic missiles at Saudi city. He stressed that reaching a political solution to the Yemeni crisis necessarily requires the Security Council and the international community to extract serious and effective pressure to push the political process in Yemen, forcing the coupers to comply with the will of the Yemeni people and implementing international resolutions in this regard through serious engagement in United Nations sponsored peace consultations without any preconditions, and to give the supreme interest of the Yemeni people to all other interests. Dr. Abdulatif Al-Zayani stressed that GCC's steadfast stance in supporting the legitimacy in Yemen and supporting the GCC for all efforts exerted by the United Nations to reach political solution to end the Yemeni crisis according to the GCC initiative and its executive mechanism. According to the medical sources, a civilian was killed and injuring at least 9 others by Houthi militia coup fire in the city of Hodeidah, which is witnesses progress of the legitimate forces since weeks ago. Field sources said that the ground-based anti-aircraft shield fired by the militia killed 1 civilian and injured others in different parts of the city, sparking panic among civilians. These developments come hours after the implementations of the Arab coalition forces to support legitimacy of a qualitative operation in the province of Hodeidah, which targeted Houthi leaders large. The General Supervisor of the King Salman Center for Humanitarian Relief and Works, Abdullah Al-Rabih, on the success of the center in delivering humanitarian and relief assistance to the most of Yemen regions. We continue to work with all success, he said. He stressed that the humanitarian assistance provided by the coalition in Yemen has forced looting, confiscation and destructions by the Iranian militia Houthi. He pointed out that the most important impediments to humanitarian efforts are the acts of sabotage and violations by the Houthi militia through the cultivation of the mines in the affected areas. Three members of Al-Houthi militia were killed in ambush carried out by the heroes of the National Army in the Directorate of Al-Maslub of Al-Jawf province. A field source said that the National Armed Forces raided a group of militia elements in the front of As-Salan south of Al-Maslub before the attack. The source confirmed that the ambush resulted in the deaths of 3 members of the Houthi militia and wounding others. The engineering teams of the National Army in the axis of Saada removed 500 mines and an improved explosive device planted by the Houthi militia in a number of areas of the Directorate of Kitaf before the defeat of them. A military sources said The engineering teams removed about 200 mines vehicles and armed vehicles and 300 explosive devices and 10 camouflage mines and 7 individual mines. The engineering teams has been able to extract and destroy more than 10,000 mines, while the Iranian Houthi militia deliberately planted dozens of mines to camouflage the citizens, but the efforts have been successful in detection and disarmament. Gunmen attacked 2 women in a province to the shadow of security chaos in the province occupied 4 years ago by the Iranian Houthi militia. The residents said that gunmen attacked 2 women fishermen in the center of the city of Ib and shot a number of houses in the citizens and created a state of panic among the citizens, especially children and women, asserting that this is a black flu and calls for an uprising victories for the screams of women. The sources added that the gunmen were some drunk alcoholic in the midst of an overwhelming security chaos witnessed by the province of Ib under the control of the militia coup. The city of Hodeidah suffers from difficult humanitarian and health conditions due to the imposition of the Houthi militia siege on the population of Hodeidah and a number of areas of the province, which exacerbated the humanitarian situation of the population of the city. Health sources reported that the number of deaths due to the cholera epidemic in Hodeidah exceeded 300 cases during the period from 27 April 2017 to August 2018. Thus, the province of Hodeidah in the top of the provinces. The number of cases of the disease since the beginning of the spread on April 27 last year, stressing that the cases of infection in Hodeidah amounting to 174,383 cases, while the death of 308 cases. Medical sources pointed out that the most of the cases that reached the health facilities are suspected of being infected and suffer from severe diarrhea. There are fears that the disease will become more widespread and difficult to control if the Houthi militia continues to besiege the city and support from organizations stops as a result of looting and selling of cholera medicines to curb the spread of the epidemic, which began to spread in a third wave in the country.